joining this webinar. For those that I haven't met formally, my name is Carmen Qadir. I would like to thank you all for joining me for this brief 30-minute session that I think will be beneficial to individuals as well as employers or leaders of business or organizations. I would like to provide just a brief summary of my background, training, and work experience. I think it's always important to share that so that people have an idea of who they're interacting with. I have primarily served the medical and research communities for a very long time. I actually completed my bachelor's and doctoral training from Tulane University in New Orleans, which is where I'm originally from. And my doctoral training years were actually completed during and after Hurricane Katrina in New Orleans, which we all know was one of America's largest natural disaster. From there, I actually trained in epidemiology at the National Institute of Health in 2014 to 2015 under the current leadership of Dr. Francis Collins, whom was appointed by the president in 2009, and Dr. Harold Varmus, who also led the National Cancer Institute from 2010 to 2015, both who are incredible pioneers in their current fields of medicine and scientific discovery. I thought it was an extraordinary experience, as it was the same years of the Ebola pandemic that took place in 2014 and 2015. So my goal after many years of training and work experience has been to just have a complete understanding of our public health system. I have served in leadership positions for large healthcare systems across the South, but I'm currently assisting various industries. And in this presentation, we will be discussing how we can manage ourselves and our team during a time of crisis and how to successfully return to a new normal and what will be considered a new normal post-crisis. And here I have illustrated some general resources that I like to glance at every so often just to see what the current status of coronavirus is. The Institute for Health Metrics and Evaluation is actually, one of my favorite ones that I go to every day. It is an independent global health research center at University of Washington. And essentially it's designed for healthcare administrators and government officials. But I have found it to be extremely informative site for the general public on healthcare and public health projections. They use the assumption, of course, that social distancing measures will be put into place to reduce deaths from COVID-19. And so what they do is that they utilize different statistical models to generate 4-month forecasts from data that is collected from local hospitals and national governments. And so overall, I think it's a production of data analytics from raw data collection from multiple health sources that is, illustrated very well on where we're headed in this unknown period. The Johns Hopkins University dashboard mapping that you see there, the mapping of 2019 and co, is basically just an overview of the current health status of our country, states, and particular cities. So that will give you more an up-to-date of the current cases and number of deaths. And I think that it's important for us to stay up to date with important scientific data reporting that is being measured by health institutions and scientists to better guide our decision-making and reopening our businesses and organizations. And so, when we think about managing ourselves during a time of crisis, we would like our businesses and organizations to survive during a pandemic, but we first have to focus on ourselves and how to manage ourselves the best way possible. Our personal and leadership growth during our trials and tribulations will ultimately decide that fate and the fate of our business. And then, in this particular drawing that I thought was really interesting, that I created and put together here, and it resonates a lot just because during a time of crisis, how we're able to translate our unique background, training, work experience into tangible and successful results is important, and it's crucial for the survival of our business. Reflecting on our skill sets and any valuable tools we have acquired or learned throughout our careers can serve as guides for exploring various opportunities of growth as our businesses evolve during and after a crisis. I think that making connections with key stakeholders in our industry is important, but making connections with professionals in a different industry that you had not previously interacted with could also be beneficial. There's always great opportunity, of course, to enter untapped territories and unknown areas for our businesses. And I think in this model that I illustrate here, when we draw up all of our successes, our education, our creativity, and any skill sets that we have, we're able to be a little bit more innovative on how we can deliver those services and products to our clientele. There's been, for example, recently in the media about whiskey distilleries that have had mass production of hand sanitizers, because we know right now that hand sanitizers is high demand and there's very little supply. And so we should think of ways of how we can deliver with high quality of our product and services to our clients. Unfortunately, our current situation is one that we need to reduce physical distance and to increase that social relational connection. And so during this difficult time, there are practical actions that we can take to ensure we remain productive and driven to be successful with our virtual connections. One of them is cultivate a connection mindset. Boosting connection begins with adopting a mindset that connection is desirable and necessary. And of course, to help cultivate this mindset among people you interact with, I think that it's important to share important resources through your social networks. Maintaining an optimistic mindset. There's reasons to be optimistic, of course. We know that China and South Korea is past the worst for COVID-19. And the United States and many other countries will get there too. We have a global effort of scientists that are trying really hard to develop a vaccine. And I think it's just extraordinary what people can accomplish when they pull together to serve a greater cause than themselves. Taking care of yourself, this is extremely important. You can't really give what you don't have. And to be a good connector with others, we need to make sure that we are physically and emotionally strong and steady. And I think we can do this by making sure we're connecting with people that energize us. Having those virtual coffee breaks in the morning and afternoon video conferences with our team, just to circle back and touch base with them is extremely important. And of course, cultivating practices that produce contentment is important, and getting creative on how you might engage in activities with others. I think that, we've seen videos of how people have just created different ways of connecting with one another. And I think that remaining engaged with our community through a healthy and social distancing parameters in place is important. Pausing to be grateful every day, taking a few minutes to write down at least 3 things that you're grateful for, whether it's through journaling or other tools, can really just help you to have a clear mind and to be able to think forward on how you would like to move forward during this time. Gratitude helps keep you, of course, emotionally strong and will help you connect better with others. Going for walks, I think that that's important, is getting that fresh of air every day and not being confined to our homes, of course, through social distancing and making sure that we're doing the right and exercising the right recommendations that have been given to us by our public health experts. Learning something new, and setting aside, of course, each day for a quiet period, whether it's through meditation, journaling again. These are just some few examples of some resources that we can use. Never worrying alone. Whenever you feel anxious or stressed, calling up a friend and talking through it is important. And lastly, and I think most importantly, is of course serving others. I think that when, anything that we can do to help others meet their needs for connections will also help us as well. And, again, this is a satisfaction that will be created, and even joy will be found in serving a cause that's greater than ourselves. So waking up daily and rising to the occasion as if it were a normal day in our business life is important. And having bigger goals and ambitions is also positive. Asking yourself, what does your current success look like now? I think that performing those self-coaching and self-affirmations are important during a crisis, and having the opportunity and time to finally reflect on how we currently view success and what success can ultimately look like during a crisis is key. Digging deep into business conversations or website inquiries more than you would have previously have done so before. Learning to be creative and supportive to business partners before they even ask you for something, and addressing their needs before they even come to you. Social collaboration is extremely important during this time, since we're basing all of our efforts on virtual connection. Of course, being resilient, adding value to ourselves and to others, and then creating action plans that I will discuss later on. Standing still, of course, is never an option. And so managing our team during a time of crisis, what I would like to call this phase is we're navigating the storm. And we basically want to ensure that our team members have the necessary tools they need on a personal and professional level for success. Navigating the impact of the crisis with a well-organized team will play a significant role in our strategic response plan. Number one, I would say talking to your team. That is extremely critical. And opening and keeping lines of communication open as we continue forward in this unknown period of virtual connection. And that engagement is key. And this can be done with with different types of teleconferences that you can set up every day. I think at times it's better to over communicate issues than to risk having them fall through the cracks. Secondly, I think that during a crisis, employee redeployment is extremely important. And in this crisis that we're in right now, it would be useful for us to perhaps redeploy our personnel or staff members to higher areas of need. The first thing is to do an inventory, calculate the number of staff members that are needed to provide essential services using your current employees. And you can do that by basing their workload. Consolidate, adjust the duties to the lower number in your department. Number three, report. You're going to create two sections here: employee resources that are needed and employee resources that are available. And this is how you can shift the work. You can shift the work from where you need to redeploy, your workers to your biggest areas of needs, and really identifying the areas that you can sort of push to the side a little bit and get more of a man work to work towards the areas of higher needs. Staff, and then match that staff available for redeployment on the areas of most urgent need. I think that as well, a crisis playbook would be important to consider, at least, in which you have, or if you don't currently have, someone that covers the human resources. This is someone that could deal with the part of the employee communications, legal, who in legal needs to be privy in communications to your key stakeholders. And of course, public relations and communications, and this is internal and external. Those responsible for written statements and monitoring the continuation of crisis. This, of course, can also include social media experts in your group that can handle the communication face of the business. And these folks will be assigned, delivering the business updates. The third thing after communication, employee redeployment, is workplace accommodations. Employees requesting an accommodation based on their immunocompromised status, whether they're over the age of 60, if they have any type of chronic serious medical conditions, or if they're pregnant, should submit an official accommodation request form that you can create in-house. Of course, you can always, gather any necessary medical certifications indicating their current health status for that workplace accommodations. Employers should try to accommodate as much as possible, because this is a situation that, has come as a surprise. None of us really had envisioned us to be in this place where we are. And so I think that it speaks volumes when the employer is willing to accommodate. In continuation with workplace accommodations, guidelines should be set in place for potential paid leave quarantine. If someone has a fever of 100.4 or above, or if they have tested positive for COVID-19, if they're currently taking care of a COVID-19 family member, or if they need to self-quarantine due to their symptoms. These are situations that you could potentially offer a paid leave quarantine with a combination of GPT, general purpose time that they can pull out from either their vacation, sick, or personal time that they have built up. Per Montgomery County, of course, persons who have symptoms and were directed to care for themselves at home may discontinue isolation under the following conditions: at least 3 days, 72 hours that has passed since recovery, defined as a resolution of fever without the use of fever-reducing medications. And number 2, improvement in any respiratory symptoms such as shortness of breath or cough. And number 3, at least 7 days have passed since symptoms first appear. And so again, I think that accommodating is very important. And I think that working closely with our employees and being sensitive to this situation and any ailments that they potentially have is extremely important. And also, I think that implementing employee assistance program in place would be very helpful. Offering your personnel COVID-19 resources could include a combination of webinars, health and safety resources, which there are a lot currently online, personal resilient resources, any type of financial resiliency sessions during this crisis. I know that some employers, have wanted to offer free counseling sessions, maybe up to 3. This could be mentally taxing for all of us. And I think that, our performance, a lot of it plays, and a lot of it has to do with, how clear our mind is. There's a lot of unwind and relaxation resources online that I have found and that I've also utilized. There's a lot of live cameras, where zoos and museums have offered for free so that you can disconnect a little bit. Also, there's a lot of online concerts that are available on YouTube, and learning to practice mindfulness is also another, resources that's available. So how do you manage a remote team, which is very challenging for some of us that have never had or been in this situation before? And I think that this is extremely important during crisis and post-crisis, is to manage a remote team. Establishing ground rules would be the first, the first item. I think timeliness, responsiveness, trust, and delegation is important when establishing ground rules. Tips on managing a remote team is, of course, developing strong and solid communication with your new long-distance work relationships, as I call them. Making sure that virtual meetings, are productive and that they encompass tasks with deliverables. I also think that it's important once in a while to have check-ins and do a one-to-one with individuals that may be struggling and may be having, difficulty working from home. Evaluating the employees via new performance tracking methods. I think it's something that we should consider, and having them do a self-evaluation on their performance, maybe bi-weekly, would also be very useful. And inviting feedback. What are the things that are working? What are some of the things that are not working? And I think also that, as a leader or business owner of a business or an organization, encouraging them to create a home office environment that will mimic their usual productivity at the office is important. And there's several remote team building, strategies that are out there. One of the techniques that I like to use that I found has been very useful in the healthcare setting has been utilizing lean techniques. And, utilizing lean techniques on remote working requires you to be intentional. Tools is the number one thing. Is video connection, again, is the best above all conference calls, emails, or chats. Methods, frequent video virtual conferencing, and alternate the presenter for the day and have them share their screen on what task they're working on. Virtual lunches are not seen or considered as productive, but it could create a virtual office connection that, most employees are missing. And team culture, building an internal community, not just connecting. Again, building an internal community from a distance is very difficult. And so I think that, sharing, for example, a wonderful off-work related story of the day for 5 minutes would be a way to help build that team culture. Some of the recommended business tools that I've listed here that many of you know about is WebEx, Business Skype, and Zoom, which is highly recommended because they offer a basic free plan. Google Drive and Dropbox for file sharing is very useful. And Slack can also be very useful for file sharing and messaging. It's important to only introduce a few tools at a time to avoid team members from being overwhelmed and to avoid sacrificing productivity. So managing ourselves in team post-crisis. And again, this phase can be thought of as the recovery phase. Navigating the storm, of course, as I labeled it, was during the crisis, and post the crisis is our recovery phase. I think that innovation and potential restructuring, redesigning of our business and team is extremely important. And so how do you launch your team post-crisis? I think establishing a safe workplace should be number one. We know that folks' productivity is driven by their personal comfort in a workplace. And per public health officials, it's important to maintain those 6 feet of social distancing. So some of the strategies that you may want to implement when you reopen your workplace would be ensuring that social distancing measures are in place, perhaps by rearranging desk spaces at least 6 feet apart. In addition, I think in the weeks to come, we will probably continue to hear more recommendations from our local and federal government on recommendations of mask use. Perhaps implementing a face mask use at the workplace can also ease some of that anxiety and provide safety. Sending out a weekly memo or even a bi-weekly memo on the safety practices you have implemented at your workplace, I think will be much appreciated by your employees. If this is a patient care setting, then these should be implemented based on, the CDC recommendations. And post-crisis assessment or review. I think that, after this crisis tapers off, members will recognize when items were left unanswered. And to implement a post-crisis assessment, we're able to accept a post-crisis reality, or what we will know as a new normal. Evaluating internal metrics. Are the metrics that we currently have in place still applicable to our business after this crisis took place? Should we maybe, redesign some of those metrics that are a little bit more in line with where we are post the crisis? And of course, there's 2 key items that are needed to share in a post-crisis assessment. And one of them is how the crisis has shaped that new reality or new norm. And this, again, will help introduce a new way of conducting business at your company or organization by either implementing new policies that address certain variables of the crisis. As an example, these new policies moving forward can provide more clarity on what has unfolded and what is expected moving forward. And gratitude would be the second thing. Thanking your team and those individuals publicly that have done a tremendous job at keeping the business or organization afloat. For example, in the healthcare facilities, there are numerous folks that have floated in different areas during their shifts, where they essentially, picked up the baton and they kept these clinical units moving forward. Another would be suppliers who have changed the delivery schedule to provide supplies faster and with a quicker turnaround time to your locations. And finally, not forgetting your customers who may have potentially waited a longer time to receive those services. And so reorganizing your team based on your needs would be, again, what we talked about in the previous slides, the employee redeployment that you implemented during the crisis. And you may want to consider keeping remote services for your team and for your clients, maybe for some time, because, maybe this is some sort of technological advancement that a lot of your clients really like. For physicians, for example, or those in the healthcare setting, virtual visits is something that I think we're moving more into. I think that a lot of patients really like to be seen from the comfort of their home, and telehealth really has taken off, not just in underserved communities, but also in communities that you could easily access your physician at your doorstep. Holding more frequent team meetings. Again, remote working may become the new normal for an unknown period of time. And so having more of that frequent remote team meetings, I think, is extremely important. And shifting that workload, assessing the workload during your team meetings with your team could also, be something extremely important. Be considerate of the psychosocial disruptions during the public health and economic health crisis. As we all know, trillions of dollars have been lost in the global GDP, and unprecedented unemployment rates and economic recession is unfolding. And so being considerate of those psychosocial disruptions during this time, because it is a combination of public health and an economic health crisis, is important. And enhancing a team coordination. I think that if we have a better aligned and connected team, then the better off your business will be post-crisis. This better connected team will allow issues or barriers to be identified much quicker. And this in turn will better prepare you to implement the necessary strategies in place as needed. And I think that these 4 elements that you see here listed is very important. It's a combination of your employees, is having that human resources, if you have one in place, and if you don't, assigning HR duties to one employee to handle all of the internal human resources issues. Communication, someone that is the internal and external face of communication of your business. And last but not least, your clients, is making sure that you're still delivering high quality of service and products to them. Oh, it keeps, so again, reaching out to key stakeholders, I think, is extremely important, because it reinforces collaborative relationships and it balances that participation that, post-crisis, a lot of them want to have. Becoming more resourceful than usual is also very important. And I think this could be a combination of reaching out to outside agencies that you probably would not have thought about reaching out to before. Additional reinforcement is, if you were never aggressive with marketing, advertising, speaking engagements, or networking, this is the time to do it. Learning additional ways to reach out to clients and meeting their needs is the key. And I think that, to have a frequently asked question digitally on your website will help redirect your clients in a very efficient manner. Some of the new business strategies that you can implement, for example, is instead of doing short-term planning, instead of doing long-term goal planning, you should shift your focus to short-term planning, using more quarterly goals and plannings moving forward. And we're very used to thinking long-term and how to implement some of our goals for on a long-term period. But I think that if we start short with just a quarter at a time, we can essentially extend it out to the fiscal year when things finally stabilize. And quality improvement. I think that quality improvement is big in the healthcare setting. I think that it's applicable in any industries. And to implement a quality improvement guide in place, it encompasses 3 different elements: planning, reflecting, and executing. For planning, it's basically project management and developing a blueprint for success post-crisis. Goals for each quarter, again, that can later be extended to that fiscal year. Reflecting is analyzing your current processes in place, where to begin and what can be done to make necessary changes. Of course, team agreement of where your shortages in your businesses exist can only be done by brainstorming or creating even a focus group. Utilizing process mapping is essentially a technique in which you have a mapping of the flow process of that service or product that can help staff and team members understand exactly the complexity of that process and how can you improve it post-crisis. It usually can serve as an aid of where to test ideas for improvement that will likely have the greatest impact to your future goals. And again, it can help assist with process analysis questions such as, in our business workflow model, can someone else perform the task? Can there be a step that can be eliminated? Can this be done in a different way or even done in a different order? And then finally, executing. Executing is implementing strategies, utilizing tools and tips for turning those ideas into actions. Of course, the business model is different from the healthcare model, but in this case, you want to be able to get support from identified parties and have them listed. Again, metrics and reporting system that will convey the results to the whole team. Data analytics of those metrics will be needed because you need to know how to analyze and interpret your data that you get in-house from your own team. As well, this will help create new workflow processes. And you also want to make sure that you have secured budget and other resources required to support all the elements of this quality improvement project within your business. Continuity exists once, improvements have been made. And I think that, again, this is something that can be implemented, post-crisis so that you're able to actually assess, where the biggest needs are and where you can change and make changes that no longer serve your business. So in this new business workflow model that I've listed here, as you can see, these 4 elements also are very important. That's protecting your most important assets and creating a team that will protect it. Your assets, again, can be physical or digital. Digital meaning your reputation, your online reviews. Your new operations and how they will ultimately impact the delivery of your product or service is very important. How feasible is your operations in a post-crisis scenario? And what part of those business operations will need to be restructured to ensure that those services and products will still be delivered. Again, going back to this chart that I posted here, and I think my apologies, it posted a little bit backwards, but again, it's digging deep into your successes, your skill sets and how you can become innovative after a crisis. And last, of course, and not least, is the consumer or clients. They expect us to still deliver high quality work. And of course, they understand that, it may not be 100% as what it was delivered before. If you're in the health profession, maybe you're a little bit understaffed and the wait in the waiting in your weight room will be a little bit longer. Again, if you're delivering certain products, maybe the supply chain is a little bit disrupted. And so there's ways to make up for that, and be a little bit more innovative to make sure that you can still protect your assets, whether that's physical or digital. And so in summary, you know, mastering, managing the human and business side of this pandemic is extremely important. Communication is key to the internal workforce and the external supply chain and business partners. Excellent communication across will allow you to make the right decisions towards that new normal. I think granting employees with more responsibility on a spectrum of issues, ranging from safety issues at work to any specific needs of the business is also important. And, you know, again, a stronger team makes a stronger business. Identifying opportunities in the new post-crisis period will essentially give you a more viable business, and key stakeholder input is important here, from your team, from your business partners, and from your client. And when I say team, you know, I think that an effective team is typically creative in identifying the most efficient and effective workflow processes. And so getting their input is very important. Potential changes to business model to secure that strong position you have in the competitive marketplace. Again, innovating, redesigning, restructuring, utilizing metrics or any indicators for red flags that could exist during this new workflow process to make rapid adjustments is very important. And you can utilize these indicators as guides for decision making that can be advantageous in the months to come. Of course, reporting these metric indicators to your team so that they're all on the same page and they all understand, you know, where there's room for improvement and where the successes exist is also key. Implementing new business strategies and workflow processes that I, you know, illustrated in the previous slides will get you that continuity of care and that continuity of business. And again, continuity of care is just having that psychosocial support that we can provide to our employees directly or indirectly, which will help them execute their roles and responsibilities more effectively. And essentially that will, you know, create a better continuity of business. And finally, you know, leading with grace and delivering with compassion. I think that at the end of this crisis, what we will be judged the most is essentially how we led our organizations, how we led our team, and in the format that we delivered that service or that product. You know, was it done with compassion? And we're very sensitive to areas of unknown that surfaced and areas of known that we were able to control the best. And again, this is just my contact information, my direct contact at the top, and some personal and professional services that I do offer. And I would like to thank you all for coming and joining me during this webinar. If anyone has any questions, I can take some now.
This is Lillian again.
Yes.
So thank you so much. This is very informative. I am a periodontist, so I am the owner of one of the dental offices and implant centers here in the Woodlands. And as a business owner, I have most of the responsibility. I'm the only doctor, so I have most of the responsibilities to manage the team. Mm-hmm. And these type of presentations are helping me tremendously just to have a little insight on what I need to do, because we are about to open, has been yes. stressful. We healthcare providers in different ways, we have been really stressed because there is not proper protection. We cannot find a lot of resources. And we really, some of us don't want to open that quick. Some of us want to open quicker. So it's a lot of stress going on, and I have to remove my hat one day and then put it back in the morning, in the afternoon, so I can talk with my team and calm them down. Right. I think when we are talking with team members, mm-hmm. being us, the leaders, we have to, before we talk, we have to be always positive with this attitude that, oh, optimism. So we don't transfer that sensation of stress to them.
That's right. That's actually correct. I think, one of the first parts of my presentation, of course, is managing ourselves, is, having that mindset that, that we are very creative in our businesses, that we are very sensitive to the underlying situation at hand that was unexpected for all of us, and that we're going to work really hard to make sure that we address the needs of our personnel. And of course, helping them with providing resources and establishing a very safe workplace, I think is important. I think that, the psyche of what we're all undergoing during this pandemic is important, and ultimately will define how successful we are in our operations. And I really just think that we have to really have, a very strong partnership with our employees, a very strong partnership with other key stakeholders, whether it's other business partners or our clients, to make sure that, before the services that we were offering it fairly, well, and it happened so smoothly, and you didn't have to think about 10 steps in between to deliver it. But that now we're at a place where we can still deliver it, with the same high quality of work. And one of the things that you mentioned is just that, is just making sure that you have that mindset, that you are there for your team members, you're there for physicians, or any other healthcare workers, and that ultimately the service that you will give is still not jeopardized.
Yeah, that's correct. Do you mind going back to your previous screen so I can take a photo and have your information?
Sure.
Thank you.
I think that, we're all going we're undergoing a very interesting times, is the best way to put it. I think that we don't want to reinvent the wheel on how we execute the operations of our business, because prior to the crisis, it was working. What we need to do is just sort of gather ammunition, so to speak, to still, and ammunition meaning tools, the right tools in place to still execute the operations of that business in a timely manner, in a high quality manner. And I think it can be done. It can be done when you have the right tools in place, when you have the right business workflow processes in place. That covers both, really. It covers the well-being of your staff. It covers, the satisfaction of your clients, and also yourself. Again, if we can't manage ourselves first and foremost, then the operational side of our business will not exist. So I think it's just mostly just making sure that we have those right tools in place, because the workflow processes that we had before worked, just that now they may need to be tweaked a little bit more to make sure that that service and that product is still, executed.
Thank you. Thank you for your presentation.
Thank you so much for joining. Well, thank you all for joining. If you do have any other further questions, I'm always available. My email or my contact number. I look forward to having other future sessions soon. I'm hoping to, have other webinars available for everyone in our community and elsewhere. And I thank you for coming here today and spending this short period with us. Have a wonderful day.
Thank you. You too. Bye-bye.
Thank you. Thank you.
Thank you.